Hey guys, the skills mentioned in Chapter 7 of the text and leadership skills questionnaire that I would use to secure staff are planning and organizing. According to our text, planning is the most basic and essential activity in a management position. Planning effectively will allow you to see the bigger picture of what is to come. This will provide structure for you within your workplace. When it comes to staffing, planning is important to ensure you hire staff that meet the necessary qualifications, will work well with your other staff members, and who share the same goals as other people within the unit. It is also important to plan for how many staff you will need to provide a safe nurse to patient ratio on the floor. This will help to reduce nurse burnout in the long run. Our text states that organization relates people and activities together to fulfill organizational objectives. One of the questions in the leadership skills questionnaire is if understanding the social fabric is important to hire staff who will work together. The leader must evaluate how well the staff work together and how problems are solved as a unit. If the current method used for problem solving is not effective, the leader must work with the other staff to create a more efficient method for organizing healthcare services. This will help to meet staff and patient needs. Using the published literature to help with staffing would be beneficial to ensure you are staying organized. It will also be beneficial to help problem solve when staffing a unit as problems arise if you need some advice. The levels of departments that I would need to work with as a leader would be the triage nurses within the floor, front office staff, insurance and billing, other managers, physicians, and human resources. Because I work for a private practice, there are a lot of different moving parts, so I'd have to work well with a lot of different people to be a good leader. I would prefer to work under a horizontal structure because this allows for the staff to perform separate activities, which will provide more efficient and more effective performance, in my opinion. Having a separation in the activities will create a better office workflow. I feel the office I work for is successful in this area because we have so many different people who specialize in different areas. For example, if a patient needs to be seen for a procedure, our insurance and billing department gather all of the insurance information and benefit information and provide that to the patient before we get them scheduled. Then the triage department helps to get them set up for the appointment as it would be appropriate depending on certain criteria and things that they need to know, and then give them all of the scheduling information. If one person had to do all of that, or if one person was having to focus on all the tasks that needed to be performed within a day, it would be pretty chaotic. So I think that it really does help to have different areas who do different things and then pass down the line so that one person who specializes in the area can help. I feel that that's more effective way to help the patient and for the overall floor or practice, in my case, to work.